Welcome to What's Your St. John Story, a 30-minute segment sponsored by St. John's United, highlighting connectivity within our community through storytelling. Today we're talking about healthcare delivery with Libby Marcus, VP of Health Services at St. John's, and Miranda Karina, who is Skilled Care Cottage Manager. Welcome to you both.
Thank you.
We are going to have quite the conversation today about how healthcare has changed, and the nature of delivering services to older adults has really shifted in the last few years, and it's making a big shift going towards the future as well. But I'm going to start with you, Libby. You have had quite a long career in healthcare. Tell us a little bit about your career, how you came to St. John's, and then after that we'll talk a little bit about what you've seen as evolution in healthcare.
Thank you. I've been a nurse for 44 years nearly, and I have seen a lot of changes over the years. I started out as a nurse's aide because we weren't even certified back then in the 70s, and I worked at a local nursing home, and so kind of grew up as a baby in nursing home care, and then I've done a lot through visiting nurse service with Riverstone. I've worked as a case manager at Billings Clinic, and then my roots have always gone back to geriatrics. And so I would say 95% of my career has been with the geriatric population.
And how long have you been at St. John's?
I've been at St. John's 17 years now, almost. And I started over at the Vista as the health director, and then a few years later, I became the director of nursing at St. John's.
Okay, and the Vista is assisted living.
Correct.
And St. John's is what we would think of typically as skilled nursing care.
Skilled nursing care, right.
Correct.
Right.
Well, Miranda, how about you? How did you find your way to St. John's? Tell us a little bit about your role.
Well, I started working at St. John's when I was 15 years old in high school. There was a program called Elder Shabar, and it was for high school students looking for just some experience, and also there was a scholarship for college attached to that, which was nice. Mm-hmm. When I graduated from high school, I took the CNA class, worked as a CNA for many years, went to nursing school, and found my way back to St. John's because geriatrics, my passion. So.
All right, and how long now have you been at St. John's?
As a nurse this time, it'll be 12 and a half years.
Okay. Mm-hmm. So your first job,
yeah,
and really the only place that you've worked since.
Yep. And it better be her last job.
And it better be her last job as well. So says her boss, right?
Yeah.
All right, well, we'll come back to the what's unique about the cottages in just a minute. But Libby, if you would talk a little bit about how you have seen healthcare evolve in the world of geriatrics. We all know what nursing homes, we have this vision of what a nursing home is in our mind, and it's an older vision. Talk about
It's a much older vision. Mm-hmm. Thankfully, it has changed and evolved over the years, because when I first came into geriatrics in a nursing home, it wasn't elder-centered at all. It was all about the nurse's schedule, the CNA schedules. And we would get people up and we would do what we wanted them or thought that they needed to do at that particular time of day. And fortunately, at the in the 80s is when the government really got involved and said, we need to put some regulations in on this. And that was a very good thing, because now the federal government guides us as to what we can do, and it's really for the safety and the love of our elders. And so nowadays, or now, everything is evolved right around the elder themselves. And we love them, we care for them. They are the center of our universe when we're there at work, and it isn't, we're trying to take away that bad stigma that nursing homes have. Back then, we didn't have protected settings where elders at that time could get out and leave and could pedal down a street very quickly. Now we're in a much more protected setting, and they have many more eyes on them. The staff at St. John's are very much educated on abuse education. They're educated with we have a wonderful CNA program, and so they get on-the-job experience. We get lots of wonderful accommodations from the elders and the elders' families as well.
Yeah. I think there was a time when you and I had a conversation about what has changed really for the elder is that they have so much more freedom and they're not medically sedated so much
Exactly.
anymore.
No.
While it makes it harder on the staff to have them fully alert, it's actually so much better.
Absolutely. We don't want to drug people and keep them in that nice little tidy spot in their room. We want them to be able to roam around. We want them to be able to live their lives the best that they possibly can. And we want to have them engaged and being stimulated. And so certainly we do not want to use those sort of medications to control them at all. And that's a
Absolutely.
good thing that the government has said you cannot do.
Yeah, yeah. And I think from my observation, having dementia and memory care separated off from other skilled care areas seems to have helped as well.
Well, at St. John's, we have dementia at every corner.
Okay.
Truly, there's a little bit of dementia here, there, and everywhere, but we do have more of an end-stage Alzheimer's type unit where those people are together, and the people there are they're much more trained to deal with people with advanced dementia. But truly, I kid you not, it is everywhere.
It is.
Maybe in our hallways as we're working too.
That could be on any given day. Absolutely.
Yes.
I wonder if I should check myself in. But Mirandy, let's talk a little bit about the cottages because that's relatively new from a concept that we were the second long-term care organization in the country to offer cottage living. So talk a little bit about what they are, how they're designed, and then what your role is within those cottages.
So the cottages are a 12, soon to be 13 room homes. And each elder has their own room, bathroom, shower, so there's not a community shower they use or bathtub. So they get to have breakfast when they get up. There's not breakfast at 8. So if they get up at 6 a.m., if they get up at 10 a.m., and breakfast is always cooked to order for them. Lunch and dinner are on a menu and at noon and 5, just for continuity. And then we have wonderful activities. We have a wonderful cottage leadership. We have a social worker, a CNA manager, that's Mary and Jennifer, and myself. And we love to just be a part of those activities, just be friends. I know there's myself and our social worker. We have a couple elders we play cards with, and just fun just to engage with the elders and be a part of their lives is truly special.
Yeah. And I've been able to go over there and play the piano, and every once in a while I walk in and it's my turn to play the piano, but one of the residents is sitting there instead. And it's just so fun to see that life.
Yep.
There is so much life to live at
Yes.
St. John's in every little nook and cranny of the place.
And it's really neat to see each cottage, we just call them the little cottage families, and how much they are friends with each other and their families, and it's pretty special.
Would you talk a little bit about the staffing, the nature of cottage staffing? Because we have what we call Elder Sharath, correct?
Correct.
Can you talk a little bit about what that model is and explain what Sharath means?
Yeah, Sharath, I believe it's companion in
Servant.
Hebrew, servant in Hebrew.
Servant.
And so they have a little extra training. So they are doing not only cares, but they're doing light housekeeping, laundry, cooking, and other duties as assigned.
So when I think of the Elder Sharath, and it's not all women, there are some men,
yeah.
but I think of it as the cottage mom.
Yeah.
Exactly.
Yeah, the person who is there to just make sure that everybody is healthy and happy and
Yeah.
And
things
there's
go well.
a lot of communication with the families too. Those families become our families
Yeah.
as well as
Yeah.
their own loved one. But they, the care plans that we carry on a monthly basis with them, they are very involved and become very close friends with the other elders and their families.
Absolutely, absolutely. Let's pivot just a little bit to talking about the last 2 years. This has been a real struggle for organizations like St. John's. And Libby, you have been front and center at Incident Command. Just for the general public who may not understand, when a public health crisis hits, a place like St. John's has protocols. Speak a little bit about
So one thing that St. John's did do was activate an incident command. And so we meet on a weekly basis, and in the very beginning it was twice a week, to just discuss how we're going to march forward with the with COVID-19. And we developed our own protocols. The federal government has really mandated a lot of the rules and regulations surrounding nursing homes. Very much different than the schools, even the hospitals or other healthcare areas. But the nursing homes, because of the vulnerability of these elders, they have made it very, very stringent. And so we meet weekly, we discuss, okay, where are we this week? What's the community rate look like as far as positivity in Yellowstone County? And then we match it up with how are our elders doing, how is our staff doing. We certainly have suffered as far as staffing, because we have had a lot of positivity amongst our staff. Not a lot with our elders, because I would say 95 to 7% of our elders have been fully vaccinated. Staff are kind of going behind. But it's been an interesting group, the Incident Command. We have people from all walks of St. John's, from social workers to foundation to the rehab department, home health and hospice. Everyone is being represented, as well as our CEO. And we really try to work hard to make our protocols augment those of the government and to make them livable.
Livable. That is the key word, isn't it? Because it has been very hard on the elders. It's been very hard on their families.
Exactly. And fortunately, over the past probably 4 months is when we've seen a little bit of loosening up of some of those guidances federally. Because that first year was, really awful on our elders and their families, because they couldn't see one another. There were window visits, there were those sort of visits, and of course end-of-life type visits. But just to waltz in and visit your loved one didn't happen, and you had to really go through a lot to be able to get in through the doors. We do suffer from outbreaks here and there throughout our community, just as we do have positivity throughout Yellowstone County. And so when we have those outbreaks, our staff are geared up in protective equipment, and they wear all the garb. And of course, we've not gone without masks on our face for over 2 years now.
A long time.
Long time.
A long time.
But we appreciate the fact that the families have come in and have been so gracious and so understanding, and really have worked well with us.
Well, I think one of the things that the community needs to know is that, the first that we heard of COVID in the U.S. throughout the media was because of an outbreak that just ran through a nursing home.
Right.
We at St. John's did not have that same experience, did we?
No, thank goodness.
Yeah, we really did not. And staff have been well, by
the
and
most part,
large,
yes.
for the most part. And now it's just breakthrough cases and a little bit of people bringing it in from people who haven't been vaccinated.
Right.
And it's still affecting our elders.
Absolutely.
And so-
Absolutely. It's hard to have a caregiver come towards you as an elder and be all gowned, masked up, and be wearing goggles. And, that's just not the way we want it. We want things to go back the way it was, and I don't think it will ever go back to the way it was,
Right.
100%. But at least I feel comfortable in knowing that what we're doing is really protecting our elders and their families.
Absolutely. Randy, I'm going to draw you back in, and you manage hiring for staff in the cottages. And talk a little bit about what that's like right now, because we are struggling all over the country, in this state and in the county. Talk about staffing.
Staffing is probably the biggest challenge that we have. We just don't have people running in for interviews and wanting to work, which is unfortunate, because we think it's a great place to work, and it's treated us well, and you know, it has to be a passion too. But you know, I think when people find that passion, and whether it's at St. John's, they usually stick with it. But in my experience, these last 2 years have been really tough, and on nurses, CNAs, everyone. And so it does make you think, you know, is this really how I want to continue my career? Is this, it's very stressful. And so I guess I just explain, you know, have hope, faith that it will get better. It has to. So, and just keep fulfilling that mission, and loving on those elders, because they really need it.
Yeah, and our mission is something that drives us to provide those living opportunities within nurturing environments of hope, dignity, and love. And when we have good staff,
Yes.
it's really easy to live out that mission. And then when we have struggles, we still live out that mission, but it's harder on each of us.
Yes.
Right.
Yeah, absolutely. So talk a little bit, Mirandy, about how did you discover your passion for geriatrics? Where did that come from?
Well, it just, I don't know, it just happened. Growing up at St. John's. I've worked there over half of my life, and when I went to nursing school, I thought, oh, maybe I want to do OB or emergency or, you know, something different. And I did, you know, clinicals and preceptorship, and I was just, it wasn't fulfilling. And so when I moved back to Montana after nursing school, I did apply at the hospitals, and I also applied back at St. John's. And I knew I'd made the right decision. It just felt like home, and I'd never worked in the cottages prior to becoming a nurse, and that's where I was hired on. And so it was, I loved it. It wasn't the nursing home, it was home.
Absolutely. And Libby, how about you? Where did your passion for geriatrics come from?
You know, I like to relationship build. And for me, to be a hospital type nurse on the floor, people come in, they leave, they come out, they leave. It's just, doesn't speak to me as nursing. For me, nursing is touching and holding somebody's hand, helping them through the last chapter of their life, being with them as they die. It's very, very important to me. But the families and those relationships, and the relationships that we cultivate through my own staff. I'm very, very lucky to have a very deep and rich nursing administration team that works with me and supports St. John's. But truly it is the relationship building, and just not having to rush through to get this done or that done, or we can take our time with these elders. They need some loving, many of which don't have family. And so for us to be able to step in and be somewhat of that family to them is very important.
Absolutely. It's a different end of the spectrum. You think of ER type nursing, where it's just treat them and get them out to their next
And it's
stop.
not for everybody. Elder care is hard.
Yeah.
It is very hard. It is not an easy, slough job. But it does allow you some time to grow some of those important relationships.
Absolutely. Well, and there is some fun that goes with it, because Mirandy, like you say, you get to sit down and play cards or cribbage and get the pants beaten off of you by those people who've been playing that card game for years and years, right?
Yes.
Absolutely.
And those elders let you know how much they love you too.
They do.
You know, that's part of it. They give back to us.
Yep, it's fulfilling.
It is. So, in the last few minutes that we have, I'd like you to take some time and just think on what makes St. John's special in your minds. Mirandy, what do you think that is?
From experience, St. John's is special. There are many things that happen in people's lives, whether it happens at work or at home, and the support from everyone that you come in contact with has been, in my personal experience, amazing. And I have not only made amazing friends for life, but I think of a lot of people as family. And that's special. And I don't think, maybe I'm wrong, but I don't think you get that at a hospital. So, yeah.
Yeah, there's a lot of places you don't get that.
Right. Yeah. In healthcare. Yeah.
Yeah. Libby, how about you? What do you think makes St. John's special?
Well, first of all, it's a continuing care community, so we get to see people who want to live totally independently, to assisted living, to dementia care, but we also serve child daycare. We've got adoption agencies. We have a wonderful foundation that's raising money and helping us to do so many wonderful things. We've got our tentacles out in so many different wonderful areas, and I think that we have such an amazing visionary in our leadership team, and especially with David, our CEO, that the sky is the limit for St. John's, and that makes it very, very special and very unique and puts us well apart from every other long-term care facility.
Yeah, facility. Healthcare is shifting a little bit. The notion of a long-term care facility, like you say, is sort of going away. Delivering services to people more on demand in the place that they call home.
Correct.
Can you talk a little bit about where we're heading as an organization that way?
We have a program called At Home, where people can buy in or pay a monthly fee to have people stay in their homes, but they will bring in a nurse to do vital signs and check on them monthly. They have maintenance people that come in and do general things for their home, lawns and those sorts of things, and also to engage them in activities by bringing them back to St. John's. We're working towards bringing people, instead of putting them in a, quote, facility, we will bring people to maybe Mission Ridge or to an assisted living, bringing them more services there so they don't have to actually pick up their belongings and move into a smaller room in the nursing home. Mm-hmm. And that's very exciting.
It is exciting to think about how we deliver those services in a new way, because the need for those services will never go away.
Correct.
People will always age and they will always become frail.
But we want them to age in place.
But we would like them to age in place. And it's more cost effective to age in place, because healthcare delivery is very expensive these days. Absolutely. Well, in our last couple of minutes, I'm going to just pose a question to you. We ask it of all of our guests. If I were to run into you in the grocery store or just out on the street, and I learned that you worked at St. John's, and I asked you, well, what's your St. John's story? Randy, what would you say?
Probably, like I said earlier, I grew up at St. John's. I started, in high school and just kept going, and I'm excited to see what happens with my story in the future.
All right.
Yeah.
Thank you. Libby, what would you say is your St. John's story?
I would want to say that it would be one filled with gratitude. Gratitude for the leadership that we have at St. John's, one for the thankfulness that I have that I've been able to work with all these elders throughout these past 17 years. Yeah.
All right. Well, and I can't tell you how many times I hear from family members who are donors, and I make contact with them, and they do talk about how mom and dad, perhaps this was not the place that they really wanted to live, or that this last couple of years have just been so hard. But the families are so grateful for the care and the staff and the level of service that they've all received. They just cannot say enough good things. So thank you both for what you do. It's not easy work, but it's rewarding, and it's something that our community deserves, and you deliver it in such a passionate way. So
thank you.
Thank you for your service.
Thank you for inviting us.
Yes.
Thank you.
That is another segment of What's Your St. John's Story, and we hope to see you next time. Thanks for watching.
For generations, St. John's has united us with its uplifting vision and lives it has touched. There are thousands of stories about St. John's. Prayers answered for a long-awaited adoption, pain-free relief after healing from injury, settling into a new home for the next phase of life. The comfort of compassionate end-of-life care, the joy that comes from volunteering, and at-home help that supports the fullest life. At St. John's, we are creating community and bringing families together. We offer many services for home, health, and family, from childcare, support for an unplanned pregnancy, and physical therapy, to home health care, senior living services, and hospice care. For all times of life, we are here for you. The heartwarming stories of St. John's are woven into the fabric of our community. What's your St. John's story?